internationally renowned and known regarding hemp policy, as she is an expert and public speaker. Now, she is a principal at Hemp Ace International, a consulting legal support and expert witness firm, a director of regulatory and legal affairs of Zillis, an international leader in CBD products, and is the vice president of federal lobbying of the US Hemp Roundtable. Ladies and gentlemen, please put your hands together for Joy Beckerman.
So wonderful, honey. Thank you. Let's see. Can you hear me? Testing 1, 2, 3, everybody. Outstanding. Thank you so much for joining me here today at USA CBD Expo. It's been a fantastic conference. I've learned so much about all the different products that are currently out on the market, and it's always evolving. Because, let's see, clicker. There we go. You've already heard all about me. I've been in hemp, by the way, guys, for over 30 years and serve on multiple nonprofits regarding creating standards, ethics, and regulations, including also the technical committee for the US Hemp Authority, which is our first certification specific to hemp extract and consumable products for ingestibles and cosmetics. And we'll learn a little bit about that in a second here. We really need to understand, though, that the FDA, as it were, has not put forth a specific regulatory framework. They, in fact, believe, and if you look on the website, and for goodness sake, this is a guidance position that the FDA has. It isn't actually a final determination or a final agency action, nor has it been tested in the courts. But currently, if you look on the FAQ for cannabis and cannabis-derived substances on the FDA's website, it says, can THC or CBD be sold as dietary supplements or food additives? And the FDA's position is no, it may not. And that's because there is something in our Food, Drug, and Cosmetic Act called the IND, that stands for Investigational New Drug Preclusion. And when a substance has been put forth as an investigational new drug, or when there has been substantial clinical research been made public, or the fact that substantial clinical research is being undertaken is made public, it starts what's called the IND preclusion process. And it means that that same substance, unless it had been traditionally in the food market or marketed as a dietary substance before October 15th, 1994, which would make it an ODI, an old dietary ingredient, that it cannot be marketed as a dietary supplement or a food additive, that it in fact would then be a new dietary ingredient. But the FDA currently is doing a lot of safety studies on CBD. Now, granted, the FDA's job in our first developed country here, our first world developed country, is to ensure that what we're putting in our mouths for human beings and for animals for that matter is safe and it's quality assured, and that there are good manufacturing practices in place. And those are all put forth through the Code of Federal Regulations. Well, there are codes of federal regulations for the manufacture, holding, labeling, and distribution of dietary supplements. And in the United States, when we're putting something in our mouths as humans, we can be one of three things legally. Three swim lanes. Think of it as three swim lanes. There's the food and beverage swim lane, there's the dietary supplement swim lane, and then there's the drug or the pharmaceutical swim lane. There are only those three, and there are codes of federal regulations for each of them. And in any event, right now the FDA says we're still doing safety studies, and we're currently, our position is that you may not consider CBD or any hemp extract product to be an NDI, a new dietary ingredient, because of the IND, the Investigational New Drug Preclusion. Good news is that they will not be, by and large, taking action against companies right now, because we're in an open rulemaking process at the federal level to create this regulatory framework. Because the FDA has not created the regulatory framework, it has put the various 50 states in the difficult and nearly for interstate operators untenable positions of creating this patchwork of laws and regulations for the manufacture, distribution, labeling, testing, and holding of these hemp-derived CBD products. And it's really a smattering of these different laws and understand that just because at the federal level, the 2018 Farm Bill indeed made legal and removed from the Controlled Substances Act hemp and its cannabinoids, its extracts, its derivatives, all of its compounds, and its isomers and salts of isomers, and we'll talk about that when we get to Delta 8, that doesn't mean that all 50 states legalized it. All 50 states have not legalized marijuana, nor has the federal government. Once the federal government legalizes marijuana, all 50 states may not legalize marijuana. It's something in our Constitution called the States' Rights Act, the states' rights. So that doesn't mean that it's legal in all of these states. And it gets very untenable for interstate operators because there are different testing requirements. And when states start to tell you different things that need to be on your label, and label space is like the most precious real estate that brand owners have. They need to say what the feds require that is said for dietary supplements or food, and then they need to say what the different states, and when the different states are telling them different things, they can't make different labels for all of the different states. It simply does not make economic sense. It's untenable and really hurts small operators and cottage industry the most. So, stuff you really need to know as a consumer, guys. Let's talk about some of these definitions. Gonna have to put my glasses on for this so I don't forget any specific details. This is very general. Understand that really when we look at the botanical industry and the botanical extraction industry, these terms get very involved and have nuances and other words that specify what types of extracts or distillates or spectrums we're talking about. But because I have so much I want to share with you in our short time together today, I'm giving you a very kind of high-level overview. The U.S. Hemp Authority, I'm sharing with you the definitions of these terms because the U.S. Hemp Authority is doing the best that it can to standardize terms. If you look at all of these different booths here today, some say broad spectrum on their label, some say full spectrum on their label. You need to ask actually each business on your label, what does full spectrum mean? What does full spectrum mean to you, brand owner? What does broad spectrum mean to you, brand owner? Because it means different things to different brands because there are not standardized terms yet that the FDA has come up with. Now, what's even more confusing is the various states, again, because of the difficult position that the FDA is putting them in by failing to or refusing to act by creating regulatory framework, they're now starting to create definitions. So imagine how untenable that's becoming. New York has created a definition for full spectrum, Vermont has created a definition for full spectrum, so on, and they're different definitions. So the U.S. Hemp Authority is trying to come forward making standardized definitions, as is the American Herbal Products Association, and we sit on one another's boards and committees and are trying our best to work together. And with that, full spectrum, what it means according to the U.S. Hemp Authority certification standard is that it defines a term used on a finished product and their labels to describe a cannabinoid or a hemp product containing a hemp extract that includes naturally occurring THC, nothing added, and other cannabinoids, terpenes, and other naturally occurring compounds that's been processed without the intentional, and I know this is complex, complete removal of any compound. So a full spectrum extract doesn't have anybody going in with a lab or through any other chemical or other means to remove a compound from that extract. It's everything that's naturally occurring in that extract. But it has a final delta 9 THC quantification of not greater than 0.3%. So that's what the definition means for the U.S. Hemp Authority. If you're in the marijuana world, full spectrum may mean something else because, of course, they're not dealing with that cutoff at 0.3. But full spectrum means a lot of different things to a lot of different people, thus the need for standardization to help the consumer to understand when they read a label, what are they looking at. Broad spectrum is essentially a hemp extract where the THC has been deliberately removed in a compliant laboratory, meaning it is ISO accredited at either the 17025 or I think 13024, we'll look at it in a future slide, using a fit-for-purpose method. We have a lot of labs out there. I'm dating myself here, but I call it Father Guido Sarducci's Cannabis Lab. That is not ISO accredited, does not even know what a fit-for-purpose method means. And by that I mean, guys, there's a fit-for-purpose method for testing a tincture versus testing a brownie versus testing a gummy versus testing a Parmesan crisp. There are different fit for method purposes, and you need an accredited lab with a current certification, and they should be very happy to show you that certification in any event. So using a compliant lab and a fit for person method that in the end has a limit of quantification of less than 0.01% THC. Why is that important? First responders, folks going through child custody battles, right? Or they're getting tested at work for some other reason, or they're on probation, for heaven's sake. Understand that if you are not using a reliable brand, because oftentimes if you're not using a reliable brand, some of their labels will say these things. They'll even say 0.0% THC or THC free. Unless you are looking at a certificate of analysis that you can verify it goes with that batch of product, you actually don't know. And a full spectrum can actually make you pop hot in a drug test for a couple of reasons. But the main reason is because most times the tests that are being performed are not expensive tests, because people are on a budget for employment tests and drug tests and so on and so forth. So they aren't sophisticated enough in the analysis of that test to distinguish between the cannabinoid metabolites. So a CBD molecule is going to test hot for a THC molecule. So just understand that if you're relying on broad spectrum for something as sensitive as a child custody battle or probation or employment or a first responder, you're going to really need to have a brand that you can trust. Isolate is defined as a hemp extract that has been processed to intentionally yield a high percentage of a single molecule, such as CBD. Now, we normally say about 97% of that molecule or above. Surprisingly, New York just came out with their revised proposed regs, and they defined isolate as only 70%. Did I tell you that, Trista? Only 70% pure and above, which is interesting because that's not how the broader national industry defines it. Has to be usually about 97% or above. Moving forward, synthetic cannabinoids, very generally, again, I have my short time with you today, guys. This gets very nuanced when we talk about synthesized drugs or artificial drugs versus synthetic drugs. Believe me, there are nuances here, but very high level. Synthetic cannabinoid, the US Hemp Authority Standards defines this as a cannabinoid that is produced in a laboratory and is not derived from the genus cannabis. Now, there are biosynthetic cannabinoids. They're derived from yeast or algae. Okay, those exist too. But then there are synthetic cannabinoids that are literally created just chemically. But we would throw all of those in synthetic cannabinoids, but then a more chemically or a nuanced set of a lexicon would even get more specific than that, again, between synthesized, artificial, etc. Cannabinoid phytochemical. Now this is, and the US Hemp Authority defines it as any substance not derived from the genus cannabis with similar pharmacological effects to those of the genus cannabis, in that the substance acts directly or indirectly on cannabinoid receptors in the body. So understand that black pepper, carrot, and many other plants actually contain these cannabinoid phytochemicals. And one of the companies that I work for actually has a whole line of mimetics, as it were, for first responders and others who don't want to take any chances whatsoever of testing hot on a drug test of any kind. So they're using these dietary supplements that are made with cannabinoid phytochemicals and no hemp at all. Okay, as we talk about synthetics, let's talk about Delta-8 THC. We see so many products on the market. It's really taking everything by storm right now. First, let's talk about what Delta-8 THC is. I have a picture of it here. The only difference between a Delta-8 molecule and a Delta-9 molecule is that location of the double bond in that chain of atoms. You can see it right there with those yellow arrows. Now the Delta-9 double bond has it on the 9th carbon chain. That's why it's Delta-9. And the Delta-8 has it on has its double bond on the 8th carbon chain. That's why it's Delta-8. There are about 31. We only knew about 30 isomers of THC. THC, I know that for all of these decades, guys, when we've used the word THC, we've all known what it meant. It meant Delta-9 tetrahydrocannabinol, or we all at least knew that it meant that intoxicating property of cannabis. Well, now that we're all starting to get real and sophisticated and starting to learn about the plant, it's starting to become very important that we start really specifying exactly what delta number we're talking about. And these are different, and even in the Controlled Substances Act, the word is not THC. The definition is for tetrahydrocannabinols. There's an S on it because there are 30, although in the last few months it's true that they have discovered yet another isomer of THC for 31 isomers of tetrahydrocannabinol. We've got delta 6 through delta 10. There may be more, but there are also different types of deltas within each number, and that's what's creating the 31. I don't want to distract you and get too lost in those weeds. I want to stay focused on some public health concerns and things that are very important for you to know as consumers. So the seemingly insignificant difference between the placement of the double bond actually can create, of course, different effects cognitively and physically. There are issues, however, and where we see a lot of people say this delta 8 is hemp derived, this delta 8 is cannabis derived. Bear in mind that the plant itself does not produce commercially viable amounts of delta 8. It produces delta 8 THC in infinitesimal amounts. The delta 8 that we see on the market today is produced by synthesizing it from cannabidiols, the CBD extract, the CBD molecules that then are converted to delta 8 molecules. Now it can be done through a passive process, and if done in a facility that has a CGMP practices and is third-party certified, and there have very highly trained labs and SOPs in place, which is the only way to become CGMP certified, then you are more than likely getting something that you don't have to worry about bleach, toxins, and other heavy residual chemicals and solvents that are remaining in the end product and showing up in your mouth as a consumer. Unfortunately, most of the products that we see on the market aren't being produced in those CGMP facilities, and so that's a major concern. And as a result, multiple states have implemented or are in the process of implementing, California and others, restrictions on the sale of delta 8 that are produced through isomerization. And there really are no products on the market that aren't produced through isomerization, again, because the plant produces such infinitesimal amounts. Now, delta 8 has incredible benefits, wonderful health benefits, it's relaxing, all of these other things. What we need to do, however, in this first world country is ensure that it is if it's going into a human being's mouth or even an animal's mouth, that it is being produced with safety and quality assurance in mind, and there are tremendously onerous but very important code of federal regulations in place for the manufacture of these products. So additionally, and this is very high level because it's something called the Federal Analog Act and all of these other things, but the DEA has determined that synthetic forms of tetrahydrocannabinol are a controlled substance. Additionally, the FDA does not consider synthetic botanical constituents, which they call SynBots in the dietary supplement world, to meet the definition of a dietary supplement, and products that are marketed for their intoxicating properties are not allowed to be marketed as dietary supplements, and DEA would consider these products to be adulterated because they're synthesized through isomerization and not found in nature in that respect. So those are some issues. So we'll just watch. As I tell all my brothers and sisters in the Delta 8 industry, you better sell all that Delta 8 now and make sure that you're asking all of the right questions and going through your entire SOP for a supplier qualification checklist, so that you can sort of expose people to what Delta 8 can do before it is regulated in your region. So these are just, and if you're in the business, guys, and certainly if you're a consumer and you're a very diligent one, or you're involved in a trade association in your jurisdiction, please write this down. These are the codes of federal regulation for anything having to do with stuff we're putting in our mouths not related to drugs. So 21 CFR 101 are the code of federal regulations for food labeling, which includes dietary supplements. 21 CFR 111 is current good manufacturing practices for the manufacturing, packaging, labeling, or holding of operations for dietary supplements. And 21 CFR 117 is the same thing, but for food, and beverage is included in food. These run our lives. So we have a lot of folks who think there is a low barrier to entry to get into this very complex and highly regulated hemp extract world and world of food. I can tell you that if you wanted to sell just a hemp seed, or for that matter, a sunflower seed into the market, you must be GMP compliant, have all of these SOPs in place, all of your testing in place, and we'll get into that. Now, one of the first red flags for, am I dealing with a brand or a company here that is compliant with the law, are there medical claims being made on their packaging? Because again, I said you're either a cosmetic or, I'm sorry, if you're being put in someone's mouth, you're either food and beverage, you're a dietary supplement, or you're a drug. And there were very strict boundaries around the claims that you can make for those 3 swim lanes. Now, there are no approved drugs being sold here or in any of the stores that we go to. The vape shops, the natural health food stores, what you see online. Epidiolex is the only CBD product that has been approved by the FDA, so they can make all of the claims in the red. Epidiolex can do anything that they actually can only say what they were approved for, which is some very rare forms of epilepsy. But an approved drug can make, as long as it's in these categories, can make all of those claims. A dietary supplement or a food cannot. So what cannabidiol can compliantly say, and they have to have an asterisk or some other footnote, and then this FDA statement here, they can say supports the endocannabinoid system, supports a healthy response to stress, helps relieve occasional everyday stress, helps occasional everyday nervousness, helps with my mood, helps with occasional sleep problems. And why am I saying sleep problems? Because if we don't say, why am I saying occasional? If we don't say that, we're actually implying a disease state. What are disease states? We all know cancer, multiple sclerosis, epilepsy, glaucoma. Those are disease states. But guess what else are disease states, guys? Pain, inflammation, anxiety, depression, PTSD. We don't think of as a disease state. Of course, it is absolutely insomnia. Those are disease states, and we're not allowed to use those words and sell our products except for under very specific, nuanced circumstances when we're selling a dietary supplement or a food. In fact, if we want to say pain in a dietary supplement world, we would need to associate it with a temporary state, such as exercise or strenuous activity. You could say helps with inflammation or pain due to strenuous activity. Helps with inflammation and joint discomfort due to gardening or exercise. That's but straight up pain relief, that is a claim that only a drug can make. I'm actually going to skip through because I could do a whole nother 30 minutes just on the difference between cosmetics and over-the-counter drug topicals, because you may ask yourself, wait a second, Joy. Because it's a whole nother very complex area of law. Bengay and Tiger Balm, they say pain relief, right? Yes, they do. And if you look on the FDA's National Drug Code Directory and you look up by proprietary name, Bengay and Tiger Balm, you'll see all of their products listed there, registered with the FDA as what is called an over-the-counter drug topical. That is different than a cosmetic. And a cosmetic is only allowed to cleanse your skin or improve its appearance, beautify, essentially. And so that allows you to say things like it's hydrating, it's moisturizing, it revitalizes, it replenishes the skin, it nourishes, it smooths and softens, it comforts dry skin, it reduces the appearance of fine lines and wrinkles, it promotes the look of youthful skin. It doesn't promote youthful skin. I'm 51 years old, guys. It promotes the look of youthful skin. I'm not going backwards here. It reduces the appearance of, or the visible signs of aging, right? And it has a relaxing, soothing scent. It doesn't cure acne, eczema. Those are disease states, guys. Rosacea, those are disease states. It doesn't relieve joint comfort. And unlike dietary supplements, there is no exception for things that are absorbed through the skin. They're either a cosmetic, or they're an over-the-counter drug topical, or they're an actual prescribed drug, that you have to go to the dermatologist for to have prescribed for you. So navigating labels, understand, you go to that 21 CFR 101, guys, it lays it all out for you. Now don't be overwhelmed, because you're going to get in there and you're going to realize that it's pages and pages and pages long. But that's why, folks understand, if you're getting into this business, it's a lot more sophisticated and complex than you think. So is there a statement of identity? Does it say like CBD topical? Topical what? Is it a gel? Is it a cream? If it comes in a bottle, does it say it's a dietary supplement? Does it say anything? Sometimes it's a CBD tincture. What is that? Is that a dietary supplement? Is it an herbal supplement? There are only so many things that you're allowed to say as a statement of identity under the Code of Federal Regulations, but it's spelled out for you what those things are. So are there any disease claims? That's your first, like I said, if those medical claims are on there, that's generally your first sign, your red flag, that if this company is either ignorantly ignoring the law or willfully ignoring the law. And if they're ignorantly willfully ignoring the law at the label stage, what along the processing and manufacturing stage have they willfully or ignorantly avoided the law or ignored it as well? So that's your first red flag. Does the label include appropriate warnings and directions? Does it have the serving size? Does it provide the number of milligrams of CBD per serving? Are the other ingredients listed? Is there a lot or a batch number or a QR code that leads to a certificate of analysis or other information? Transparency. This is the certification seal you want to be looking for in your products, guys. The US Hemp Authority certification seal, and then check it on the ushempauthority.org website, because we are also seeing some fraudulent use of that seal. Again, we're in an emerging industry. Asteroids are hitting meteors. There's a lot of explosions as everything emerges here, so just double check. What is this supplement facts telling me, okay? I want you to really take a peek as best you can on that screen. That one in the yellow, that's the good one there. That's what is telling you. This is how many milligrams of hemp extract are in this product. But of the milligrams of hemp extract, if I'm buying this product as a consumer because I want the CBD content, telling me how much hemp extract is in it is not telling me how much CBD is in it. I need to know that part. That's the part I need to know as a consumer. And I need to know that you're paying attention to the laws for labeling your dietary supplements, which would require you to tell me that in exactly that manner in an indent. So that's telling us that yes, there's 8.34 milligrams of hemp oil extract in that product per serving, and of that, there's 2.08 milligrams of cannabidiol. That's what you want to be seeing. But we often see things like hemp oil extract, 15 milligrams. Okay, there's 15 milligrams of hemp oil extract. How much CBD? How much CBG? Like, what is that telling me? Or we see CBD, that's another one, the lower one here, guys, I want you to pay attention to, because when it just says cannabidiol, the next question is, I think this is an isolate product. They're not talking about hemp oil or hemp oil extract or hemp extract. They're just naming the isolated molecule. So then the next question is, hey, is this product come from an extract or is it an isolate? And believe me, isolate works just fine for people, and there are states where only isolate is allowed, believe it or not. And so God help the consumer, they'll take what they can get. They want to get the CBD into their body, but it's important for you to, what are these labels really telling you? Finally, we'll wrap up here. Oh, this is such perfect timing. How much am I really paying per serving, okay? Let's pretend you have a large bottle of CBD tincture. There's 3,600 milligrams of CBD in it, okay? And you look at the back of it, and it says one serving is a quarter of a dropper, or half of a milliliter. And then it says, how many servings in the bottle? 240. Let's pretend it's a 120 milliliter bottle. And then it says there's 15 milligrams of CBD per serving. Tells us how many milligrams. We're going to take our price, we're going to divide it by the number of servings, get to how many milligrams are there. $1.04 per 15 milligram serving is how much you're paying, because there's 240. Now, if you take more than that, and guys, I take 120 milligrams minimum of CBD a day. So if you took more than that, obviously you're just going to double it. If you took 30 a day, but understand, start low and adjust up. If you needed to take that much, wonderful. If not, some people can manage what it is or get the effects they want to achieve by 5 or 10 or 15. But understand, generally speaking, CBD stays in your system about 6 hours. I'll wrap it up with capsules. And that is, again, another simple example here. You got a jar, one serving is one capsule. There's 60 capsules, 15 in each, 900 milligrams in the whole jar. You're paying $79.99. You've got 60 capsules, so you're paying $1.33 for a 15 milligram serving. Double it up if you're taking that twice a day, etc. I will just wrap up with one more by making sure you know that there are these other, you'll see things that say more bioavailable or liposomal. And understand that you may want to try different kinds of delivery systems to see what works better in your body, because sometimes these lower milligrams that are more bioavailable can come to you at a better value and work better for you. But everyone's endocannabinoid system is different. They're like snowflakes. Every single one of them is different. And our endocannabinoid systems aren't going anywhere, guys. It's just like discovering that the world is round when we all thought it was flat. So learn more about it, experiment with products, but be good, well-informed consumers and ask good questions. Thank you so much for listening, everybody. Have a great rest of your show at USA CBD Expo.
Ladies and gentlemen, give it up for Joy Beckerman. Wow, you were so informative. Thank you so much. Thank you. All right, coming up next to the main stage, we'll have our next speaker coming up very shortly. This is the all-woman panel. It's women in cannabis leading us forward, and they will be taking the main stage at